Okay, everybody, it's time, I think. So my name is John Wilkes. I have the privilege of being the Chief Executive of the Institute of Health and Social Care Management. And today is a big day. We've got a session on compassionate leadership and organisational growth. We are being led today, not by me, but by Claire Mould. Claire is a very loyal and long-standing member of the Institute. She's done a heap of different things for us and with us. She is the founder of Curve Strategic, and I'm going to hand on to Claire in just a moment. Just to be clear, we are recording this. If you would rather not be recorded, switch your camera off and make sure you're on mute. If you do still want to contribute to the chat, that's absolutely fine. We can remove you from the chat when we edit this before we send it out for members who can't attend today. And can I just have a big shout out for the Welsh contingent today? Huge numbers of you from Wales. I know that compassionate leadership is an absolute mainstay of the Welsh NHS approach to leadership, and fantastic that's the case, and we're thrilled that Health Education Improvement Wales have played such a key role in that. Claire, I'm going to hand straight over to you. Thank you very much.
Wonderful. Thank you very much, John, and it's great to see everybody. Thank you so much for hooking in, and it's nice to see some new names come up, but also some familiar faces. So what we're going to do is we're going to, as also with these, always with these power hours, we're going to canter through. That's the whole point. We get an awful lot into an hour. There will be activities for you to have an opportunity to do some internalisation of where you are and thinking. This is a interactive session as much as you want it to be interactive. So do use the chat, do put your hand up. I'm absolutely, even though I'll be galloping through, I have no qualms with John saying, hold on a minute there, Claire, someone's got a question, and we take time because this is your hour. So if we end up spending 5 minutes talking about something that's come up in the chat, have no problem with that. We want you to get the very most out of this. Okay, so I'm going to start sharing my screen now. So hopefully everybody should be able to see that. Are we off? Can you see this? Everybody see the screen?
Yes, Claire, go ahead. We're
brilliant. Good. Wonderful. So as I say, so a focus of this is compassionate leadership and successful, sustainable organisational growth, because the whole premise of this is it's wonderful, of course, to be compassionate and be a good leader, but the whole point is actually we want that to lead to successful, sustainable growth. So what we're going to cover is we're going to decant what is compassionate leadership. How does compassionate leadership differ from other forms of leadership? The direct link between compassionate leadership and successful, sustainable growth, and how this can be achieved in practice. Okay, and where better to start than with Dalai Lama? When we are motivated by compassion and wisdom, the results of our actions benefit everyone, not just our individual selves or some immediate convenience. And that's the premise of this leadership, because sometimes we've got to be reminded, what is the point of us doing this? Is it just to benefit ourselves, for us to reach our targets? But actually it's a wider goal than that, or some immediate convenience. Actually, compassionate leadership is actually about long-term embedded growth. It's about helping everybody get up to the summit. It's about helping everybody get to where they want to be, and as you as an organisation need to be. You notice, if you see on this slide, the person isn't grabbing the flag for themselves. I'm the first one here. It's helping until everybody's there, and then you achieve together. Okay, so the first activity we're going to do, and I'm going to give you 5 minutes to just take some time to think about this, and also feed into the chat to think, actually, what have you been motivated to do by compassion? when you're in the workplace, or it might be a home situation that you think, no, actually, I feel really strongly about this. I feel compassionate about this. So take a couple of minutes to just think, what have you been motivated to do? But also then to think, what was the outcome of that? And who did it benefit? Who did it impact? And when you start thinking, please put things in the chat. And if you want to say something, put your hand up. So John, who's very kindly assisting me, will be able to let us know. OK. Right, just another couple of minutes. Just one more minute then. OK, so everybody had a chance to have a think about that. John, has anything appeared in the chat or the?
Yeah, we've got Sean says, pay it forward. When somebody supports or helps me, I make sure I pay it forward and help support others. Hashtag good karma.
Brilliant.
Claire, I don't know what you're doing with your scrolling.
I know. Sorry, I was trying to be clever so I could see the chat and it didn't work.
So we've got Leanne says, noticing when colleagues are having a tough time.
Brilliant.
Simon says, try to employ every day to give patients least delay from test to result to prevent excess stress. That's good.
Yeah. Absolutely. And some really fantastic and the things that I loved
there's a load coming through now. I don't have we haven't got a chance to read them all out.
But the great thing
it's basically it's all built around just personal, empathetic, thoughtful, caring to actually try to find out how people are feeling. It's really revolving around that, I suggest.
Fantastic. And that doesn't surprise me in the slightest, because again it comes back to that point that that we heard with the Dalai Lama about is helping the greater good. That the whole point, what was the outcome? Who did it benefit? Actually, it benefits more than yourself. What have you been motivated to do by compassion? And it helps things. Actually, paying something forward is really nice. That surprise that actually somebody's done something that you weren't expecting. Treating colleagues and noting if they, need support at a time. Things like getting results through to patients and clients. That shows that level of empathy, that actually this is really important for somebody. It means an awful lot. I know that I had some tests done recently, and somebody actually phoned me up at like 7:30 in the evening, and it actually made me feel really good, because they could have waited, and then and it was a doctor phoned me up themselves at 7:30 in the evening, and it meant that I was able to then have a far better sleep that night than waiting till the next morning when the reception was open to hear my results. And you think, well, actually, what a really considerate thing to do. They didn't need to do that, but before they went home, they gave me a call. And that is people that are compassionate. And I just think when we're looking at health and social care, the whole point of why do we do what we do? We do it mostly because we're compassionate. So we want to make sure we are compassionate leaders. So West, it's funny because John and I were just talking just before we came on, and John was saying, oh, West has done a load of great work on this, which indeed they have. And it's compassionate leadership involves a focus on relationships through carefully listening to, understanding, empathizing with, and supporting other people, enabling those we lead to feel valued, respected, and cared for, so they can reach their potential and do their best. I mean, for me, that is leadership goals right there. Actually carefully listening to and then understanding, you know, the whole point that we've spoken about before about that, seek to understand when you go into a communication rather than seeking to be understood. Empathizing, trying to take the time actually to imagine what it's like from their perspective rather than thinking, blimey, I'm really, really exhausted. I've finished my day's work. I'll get onto that tomorrow. Thinking, do you know what, picking up the phone and supporting someone or saying, do you need a little bit of more help with this? Makes all the difference. Supporting other people, and that will make people feel valued, respected and cared for, so they will reach their potential and do their best work. As this slide emphasizes, you know, somebody just getting can just be a simple text going, do you know what, you did a really good job today. That can make somebody's day. It's the we all know we're going to have challenging days. We all know this isn't an easy sector to be working in. But actually positively acknowledging somebody, valuing them, saying, actually, do you need a bit of support like that? Do you want me to stay behind and help you with that? Or thank you very much for what you did. It makes people's days. None of this is really expensive, resource heavy stuff. This is simple human interaction that can make a world of difference. So we looked now, Atkins and Parker, who break down, and I really like this, that compassionate leadership involves 4 behaviours. Attending. And by that we mean that leaders who actually people feel that they are in attendance. How many of you have had leaders before that are sort of there in name, but they're not really present? One of the reasons is, and John says that, you know, I've worked with the Institute for a long time now and I love it. And what I really love about it is John as a CEO is really, really hands-on. You know, it's really great. You know, he attends, you know, he's literally not only physically in attendance, but he has buy-in there, genuinely there. You don't feel as if he's just somewhere up there that's outside growing the organisation to get more funds into it, but actually doesn't care about it. Attending. Do we attend? Understanding. Do we take the time to genuinely understand? Now, it's really important for us to appreciate that this doesn't always mean we agree. And actually, I find understanding far more useful when I don't agree with somebody, because by that, I think, even though I don't agree where you're coming from, me taking the time to try to understand it helps me deal with the scenario. When I'm dealing, I often sort of go into organisations and I help, you know, things, particularly sort of breakdowns in communication between, you know, it could be the board and the CEO, it could be with regard to internally with the CEO and the senior management team, or across managers working in complex multi-sites. And actually the frustration comes because everybody gets exasperation, and we hear phrases like, oh, it's like banging your head against a brick wall. They're just not getting what I'm trying to say. And I go, well, have you taken the time to understand what they're trying to say? Because then, even if you don't agree with it, that'll help you frame your response in a way that they'll be able to appreciate. When we turn around sort of sometimes say, right, okay, I understand where you're coming from. Actually, I'm confused. I'm not really sure that it would work in this scenario. Or could you explain that in a little bit more detail, how you think how that would work? And sometimes that involves, from a compassionate leadership perspective, I always say, I do a list of pen portrait, what makes it easier for me to help you? And I do list 5 things. What makes it easier for me to help you? And one of the things is actually saying, bring a solution. Bring a proposal. Don't just grumble to me and say, oh, this isn't happening, this isn't happening. Say, right, well, what would be your proposal then? So at least I understand what would happen. What you would want to happen, rather. Empathizing. Take time to realise that we've all got lots of other things going on in our lives. So often as leaders, we gallop in and we're going, well, actually, no, I've come straight from this meeting to another meeting and I'm giving my time, and look, I've given up my time to do this. Actually, just because people might not be in a leadership position, they're still giving of their time at that moment, and they've still had things that have happened before that connection, that meeting, that communication, that piece of work, that delivery, and things that are happening afterwards, that whether we like it or not will impact what they're doing. And as much as leaders, you could turn around and say, well, leave that at the door. You come in, you do this. You've got to put, the clients first, the patients first, the service users first, colleagues first. We have to be realistic that in some cases, and with some individuals, they find that really, really difficult. And again, if we can empathise what they are experiencing, it helps us support them, which leads us on to the 4th behaviours, is actually we are there to help as well, because it's within our gift. If we want our management team, our organisation to optimise its potential, we want to know how we can effectively help them, rather than just barking, saying, well, you should know how to do this. Actually, how can we help them? So the next activity then.
Claire, forgive me, just a quick interruption. We had a question from Simon,
Yes.
who says, what if your boss doesn't value this approach? So there we are, you've just been through the 4 key behaviours.
Yeah.
What if your boss doesn't value this approach? Have you got any advice for Simon in respect of, or anybody else listening in who might be suffering from that? Anything that we might do?
Yes, absolutely. And thank you very much for stopping me. Like I said, I have no problems with that. And it's a really valid question, because I get asked this an awful lot when people turn around. If I present on this, people go, yeah, but actually you're talking to the wrong people. We love hearing it and we completely agree with you, but we're not the people that you need to be speaking to. It's my boss, the owner, whomever, that does this. And to go back, what I would say is, let's go back to these 4 areas, even if they don't, is the first thing is try and understand why they don't. Where are they coming from? Because it's frustrating for you. Whereas if you continually say, yeah, but they just don't get it, just ask them a little bit, saying that, well, where are you coming from? So just try to take the time to understand what pressures they may be under, what pressures they may be experiencing, so we can empathise them. And I know that that is incredibly challenging when you've got somebody that can be quite dogmatic, or somebody that actually isn't very pleasant, and it's very difficult. But remember, this is us getting what we want. And I was doing a piece of work with some unions actually recently on effective negotiation skills. And one of the persons said, oh, but I don't feel that I'm listened to. They're shutting me down. And I said, yes, but you're going in and it's immediately that confrontation. But take the time to actually sit down with them and say, right, what is it that you want us to do, which I'm sure you already do, but understand that if they get, because they'll be giving key performance indicators, they'll be working within remits. When I found the biggest challenge with this is when I've been trying to work with commissioners who are on a fixed budget, and I'm trying to say to them, but you're not giving us enough money to run the service. And there's no point continually and they're turning around going, well, look, this is the only money we've got available, and they appear not compassionate. Whereas actually go to them with a solution saying, actually, do you realise this would work more effectively if you understand that they're driven by finance, reaching their key indicators. Point out to them that using this strategy will be a more effective way to increase the bottom line, to achieve those targets. And actually, if they don't invest that, even if they don't buy into it, understanding what their goal is, I 100% guarantee that coming from a compassionate leadership perspective will enable you to get there, because what it'll do is there's enough research to show that more profitable, long-term sustainable companies, organizations, departments run from a compassionate leadership, because you're not spending the money on people getting burnt out and stress. Recruitment and redundancy aren't such a big cost because people are staying longer and people are working within their jobs. From reaching that, we know that compassionate teams reach their goals sooner. So it's beginning to point out all of those things, and hopefully some of what we're doing today, you can take this to them and say, actually, there is evidence, and it is a difficult conversation, but it's important to have that conversation. And I'm very happy to sort of continue this outside of this meeting, if this really is a challenge, Simon and others, that you are struggling with. Okay, are we all right to move on? Does that, I know it doesn't exactly do, but as a whistle stop, is that all right as a response? We're happy to carry on.
Yeah, please move on now, Claire. Yeah.
And also and do think, Simon, just cross-reference how these can be, transferred elsewhere as well. So this activity, listening, exploring, feeling and acting. Reflect and share a time when you have listened with fascination. And by that, I mean, not listen thinking, right, actually, I'm going to give a response to this now, but actually listened and been genuinely interested in what somebody's wanted to say. And how has that felt? And what have you done with the information you've garnered from that? A time where you've valued and explored conflicting perspectives. I touched on that earlier. The things I find more delicious to try and understand are where actually it's where we conflict, because that's where I learn more. Where you've mirrored and felt colleagues' distress, frustration, joy, without being overwhelmed. Compassionate leaders don't get overwhelmed, but actually you think, actually, I can see that you're finding this distressing. I can see that you're finding this frustrating. And have taken thoughtful and intelligent action. I love that phrase, thoughtful and intelligent action to support individuals and teams. And that's the piece that ultimately we all want, whether you buy into compassionate leadership or not. It's people that are taking thoughtful and intelligent action. So it's 12:25 now. We're going to have till 12:30 to think of each of those 4 points. I know we're cantering through, but you can take these away with you. But just to help our dialogue today, just go away and have a think about a time when you've done all or one of those areas. Okay, just a couple more minutes then. Okay, if you can just start pulling things in, we're just moving into the final minute then. Right, just the last few moments then, and then we'll come back as a group and we'll see whether if people have been putting things in the chat. Okay, John, are people beginning to populate the chat?
Yes, they are, Claire. We've got various different things in there. Completing work-related stress risk assessment and make reasonable adjustments for staff. That's from Victoria. Sean says, through a recent RCT as part of an improvement group in work, I met with the Assistant Director of Dental. It was fantastic as we were able to share experiences, background, etc. Look here. Joella talks about listening with fascination. I love that, Joella. That expression, listen with fascination. Very good.
It is. It's really, really fantastic, isn't it? It's really good, and it is that, you know, doing the stress assessments and the shared spirit, and what I'm beginning to hear is when you're doing these things, it's actually that prevention piece. So you're preventing people getting stressed. It's not the reactive. Compassionate leadership is about preventing stress-related issues, preventing breakdowns in communications. There may be some, but at least we can mitigate the risk of them. And these are great activities to share with your teams and your colleagues. Phrases that you can use and take away with you. You know, as John said, we both absolutely love the expression, you know, listening with fascination. You know, thoughtful and intelligent action. What are things that compassionate leaders turn around and say, well, actually, I would like you to, you know, is that thoughtful and intelligent action? So we move on. So this is what we look like as compassionate leaders. We empathise. We empathise with colleagues, and we're hearing a lot of that in the chat at the moment. Really encouraging empathy. We seek to understand rather than be understood. And again, those of you that have leaders or bigger bosses in bigger organisations, you know, that, you know, aren't compassionate, I put money on the fact that actually they're seeking to be understood all the time, whereas they need to take time to try to understand more. Compassionate leaders commit to supporting others to cope with and respond successfully to work challenges. And that's the whole point. It's all very well, but that's in your job description. You should be able to do that. That's a simple task. How many times do I need to ask you? If somebody's struggling, it's actually just far more effective for the whole organisation to support them to cope with that. Because what's the alternative of that? That we have individuals that aren't coping. And the individuals respond successfully to work challenges. Sometimes leaders, you always think that they set people up to fail. Whereas actually we want them to respond successfully to work challenges. Compassionate leaders focus on enabling those they lead to be effective and thrive in their work. We want to pass on the baton. We want them to go on and do more and more. I always say, I get asked sometimes about when people sort of say, what legacy would you like to, leave in an organisation? What would be your ideal legacy? And I always say, actually, my ideal legacy is that I can just go out the back door and nobody notices. Because actually, I've established an effective team that's thriving, that we've got processes in place that they can carry on without me there. The last thing I want to do is, as soon as I close the door, everything falls apart. My legacy is actually, you don't notice I'm gone. And then the final one is create an inclusive, psychologically safe environment. That's an environment where people, if you have got challenges, can actually put up your hand and go, actually, I don't understand that. I'm finding that quite confusing. And I'm sorry, I know you asked me to get this done by this afternoon, but I'm really struggling with this. Is there any way that I can get some help with this? Or is there any way, do you mind if I prioritise this over something else? Without feeling that people are coming back, because people are feeling that anyway. People are struggling. People are, struggling with a variety of things. So we might as well have an inclusive environment where that's open, because then we know how to, how to handle it, how to help people. Edmondson and Lay say, in safe teams, there are higher levels of learning and innovation. Again, this is a callback to those leaders that aren't compassionate. Doesn't make good business sense amongst anything else, because if you don't feel safe and you feel threatened, you're not going to want to put your hand up for more learning, and you're not going to want to come up with innovative ideas. In contrast,
Claire, John Ellis has written an interesting thing in the chat. He says, be cognizant of the person's racket, as per Eric Byrne, 1962. The racket being their socially acceptable expression of feelings as opposed to real feelings. And then Stella goes on to say, creating a circle of safety where we can discuss different views. I like that, Stella. The circle of safety. You heard it first here from Stella Wint. There we are.
Oh, Stella, that's wonderful. And I like that. And I'm brilliant. And thank you, John Ellis, for that. Yes, really, really excellent point that people actually present as they think that we ought to, feel we ought to present in meetings, rather than actually how they are feeling. And that's so important, because how frustrating is it as you as a leader, if everybody's nodding, you go, right, is everybody all right with that? Is everybody, does anybody need any more support? Is everybody, and nobody says anything, and then the minute you go outside, everybody grumbles about it, or people go, oh no, I'm really, really worried about that. We'd rather create an environment, that wonderful phrase, Stella, that circle of safety, where people feel safe to go, actually, do you know what, I'm feeling a bit uncomfortable with this. And in a blaming culture where people are fearful, it inhibits compassion and it prevents learning. And actually, going back to the hard-nosed people that may not be as compassionate as we want, it really does impact the bottom line. It really does. If you feel that everybody's pointing the finger at you the whole time, oh, I'm really worried about taking this piece of work in, you just look, you're going to be a very small person within that organisation, because you just feel as if people are quite literally pointing the finger all of the time. So very quick, snappy activity then, and all of these I do so you can take them away with you. So I'm literally going to just do a bit of fun in the chat, really, populate this as we go. I'm not going to give any time for it, just populate as we go. What are the first 5 words? But just think of a couple of words. You can take it away and do the 5 words. But what are the words that spring to mind when you think of the word safe? When you hear the word safe, what words immediately come to mind? Let's have a bit of fun. Just first thing just comes to word. There's no right or wrong. What comes to your mind? Populate the chat with it.
We've got words like trust, secure, protected, understood. Yeah, more protection, well, trust again, protective, safe, non-judgmental. That's from Simon. Cared for, says Rian in Cowbridge. Big shout out for Cowbridge, Rian.
The Cowbridge.
I think I'm one of your patients, dare I say it. Not going to be harmed, trusted. Lots of good stuff there.
Brilliant. And then let's do the antithesis of that. What are the words that you think of when you hear the word blame? And first thing that comes to mind.
Yeah, we got judged, fearful, shame, ashamed, isolation, criticised, fear, judged, fault, anxious, unsafe, says abused, even one there.
Gosh, some really,
Fearful.
really strong language.
There we are.
And this is a great activity for you to do with your teams and if you may your wider teams, and because you listen to those words and then at the end of it, you know, ask your teams to list the first 5 words that they come to that think of safe and think of blame. It's a very simple activity. People think, well, this is all obvious stuff, but then the next point you make is, well, which camp would you rather be in? Do we want an organisation where people feel abused, where people feel neglected, where people feel judged, where people don't feel safe? Or do we want an environment where people feel that they can thrive, that they feel cared for? What would you rather have? Which would common sense tell us would be the most effective environment? And again, these are all things to take back to the naysayers who say, oh, this compassionate, wishy-washy stuff, it's a waste of time. It really isn't. What would be more effective? And this is the bit that hits people between the eyeballs, the direct link between compassionate leadership and organisational growth. Research shows that employees treated with compassion are more engaged and motivated. Off the back of the exercise we just did, of course, if you don't feel safe and you feel judged, you're not going to be engaged and motivated. You're going to be feeling threatened and non-engaged because you don't want to be part of that gang. And then engaged and motivated, this is where it gains momentum. Engaged and motivated employees with high levels of well-being because they feel cared for, because they are working within a circle of safety, provide higher quality of support and caregiving to others. So important, both within the work that we're doing. We go right back to the point of what were you motivated to do compassionately. We heard of some really, really lovely, wonderful things. They are people that are providing higher quality of support and caregiving to others, getting those test results over. Clear goals and good team leadership leads to lower levels of stress. If you can have this open conversation, so actually there's clear goals and everybody's working as part of a team, it lowers the level of stress. And then the final point, so much research tells us that employee engagement, satisfaction and well-being result in improved financial performance. And I know that in health and social care, we're not all about finances, but actually it is important. it is important that we are viable, because if we've got really, really reduced funding, we need to make sure that the funds we've got are spent in the most effective way. And the most effective way is to spend as much of those funds on the individuals that we are working to support and to provide care for, not to be spending it on ongoing recruitment, on having to parachute in consultants to help us out with an issue that we're having, to get involved in tribunals. Actually, we want those funds to be used in the most purest of ways, that we want, that are helping us do what we want to do. Again, another quote by West: meeting the core needs of staff can help transform their work lives, and in turn the safety and quality of the care that they deliver. This is researched, in-depth researched, factual stuff. If we want to improve the safety and quality of those that we are working for, we need to meet the core needs of the staff that we're working with. And also, if you are a leader, feeling in some small way that you can help transform one of your colleagues' lives, it's not overstating, because we know ourselves that when that's worked to the detriment, it can transform it in a negative way. But we've all got golden nuggets, to quote Handy. We've all got golden nuggets in our life that have transformed our work lives for better and have definitely improved our practice. Tresiak and colleagues refer to compassionomics. Compassion is the most powerful intervention in healthcare, and that compassionate healthcare is beneficial for patients through improving clinical outcomes, for healthcare systems by supporting financial sustainability, through lowering burnout and promoting resilience and well-being. Again, even the biggest naysayer, if you've got evidence, which we have in abundance, that compassion is the most powerful intervention, it is the most beneficial way of supporting the individuals we have as patients, or we have as support teams, through improving clinical outcomes. The direct correlation between compassionate teams and improved clinical outcomes, helping, as I touched on before, with that financial sustainability. And Lord knows, in the current climate, by lowering burnout and promoting resilience and well-being. So how can we achieve this in practice? We need to prioritise engagement and motivation. We don't start at the end point saying, like, these are the targets, this is what you've got to do, this is what you've got to get through. We prioritise engaging people to begin with. We know from a neurological perspective that when people's well-being is high, the emotional bit in our brains emit chemicals to the cognitive bit of the brain. If we are threatened, those chemicals won't be emitted. It means we won't be engaged, we won't be motivated. And we can do this by finding out employees' interests and passions. We are humans at the end of the day, and this doesn't mean spending hours and hours just chitty-chatting, gossiping, but actually, what are you passionate about? What are you interested in? What makes you think that, you know, I'm interested in you, you know, and that means leaders finding out a little bit about interest, because you can turn around and say, oh, I didn't realise that, you know, that you were into gardening as well. I didn't realise that, you know, you sang with a choir. All those little bits, you don't have to take ages doing that, but actually say, oh, you know, what are you doing on your time out? You know, oh, you're reading a book. You know, I was speaking with someone the other day, and they've set up I must admit, I'm a bearer of a very simple brain. I don't have Kindle and things. I stick to buying books from mostly secondhand bookshops, and you know. But somebody was saying actually we have a Kindle book club where we all have a Kindle and we share it between the 5 of us, and then we make sure we read it because it encourages people to take time out. Lots of these strategies. We know.
We have a comment.
Oh, please do.
Comment. I've got to bring it in here. Comment says, I think time is one of the major factors here. Speaking for myself, I would love to dedicate more time to staff welfare and team building. Unfortunately, the demands of the sector really limit this. I'm sure you would like to comment.
Yes, I absolutely would, and that's a really, really good point, because people do have time. And what I would invite you to do there is, and I have done this analysis myself, because this is something that so often people say I haven't got. In fact, there are some research where people sort of say, actually, a percentage of people say I haven't got time to be compassionate. But then have a look at how much time is spent within that day unpicking negative issues, explaining things over and again, taking time up with things that actually, if we prioritised engagement and motivation to begin with, we would have greater time to achieve that in the end. Because if you actually do an honest analysis of how much time you get backwards and forwards, I mean, I've done it this morning with somebody that was emailing backwards and forwards. It was like a toothache. And you think actually that should have been dealt with from the onset and not allowed to get to this point. But I'm not saying that it's the easiest thing in the world. Just start with simple things, without turning around and saying to somebody, oh, did you have a good break? That doesn't take any time at all. Making eye contact, start simply and then build from there. Just the nods, the eye contact, turning around saying, well done, that was really, really good. It doesn't take time. Taking a minute to think when you send that email, have I sent it in a way that, is it just barking instructions? Or is it that I was dealing with an issue yesterday, because I'm doing an awful lot on conflict resolution. So all of this I can relate to, because I'm dealing with a lot of healthcare organisations that are in this at the moment. And somebody had turned around and they'd said to them, they'd asked a question through email, and someone had just emailed, they'd say, would it be possible for you to do whatever it is they asked? And the person literally emailed one word, no. And that opened an absolute hornet's nest of, well, that wasn't a very professional response. I'm your boss. I expected this to. And the person turned around and said, look, I really didn't have any time, and all I did was emailed no. And I had to work with them, and I said, yeah, but it probably wouldn't take you much longer to say, unfortunately, I'm not able to, because I've already committed to do this afternoon. Rather than you saying no, brought that negativity. So it's just things that take a split second. Can I refashion how I do this?
10 minutes, Claire.
Yeah, I know, I'm on it. Nurturing and supporting growth. Creating and nurturing this psychologically safe environment, identifying your passions and interests. If you say to them, oh, actually, I went away and actually I went for a hike, or I read this book, people think, oh, there's some human time there. Again, it doesn't take very much more time to do this, but give permission to dedicate time to being compassionate. And the most important thing as we come to the last few moments is, to thine own self be true. So when you are saying, I'd love to do this, but I haven't got the time to it, think, actually, why did I come into this? How can I reposition what our day looks like so I can be true? Because I want to be more compassionate. How honestly can I be true to myself and reposition just small things to begin with, so I know I'm true? We started with the Dalai Lama, we're finishing with Polonius. Now this sums up that question perfectly, because I have been asked it so many times. You can go through your daily activities with brusque efficiency and let people know how busy you are, or you can go through your day valuing human connection and showing compassion, and it actually doesn't take any longer. Not the huge things I understand you need to build in, but small steps. Because otherwise, if everybody's seeing you like this, it's not productive. So the takeaway activity, as we come to allow 5 minutes at the end for an open chat, block out time in your diary to dedicate to being compassionate. And that means not loads of time. Find out the interests and passions of at least 3 colleagues. I promise you it won't take any time at all. And make time to reconnect with your interests and passions. That's so important so you don't get burnt out. And identify how you're going to optimize this information. So you've started with those small pieces, which literally saying, oh, did you have a nice evening? And I know you did a long time, you know, were you able to, what did you do in your time off? You know, what do you do at the weekends if people work, you know, have weekends off? And then identify, begin to think, how can I optimize this information? Can we start a book club? Can we start a walking group? Can we just hook people together that are all interested in singing? Most importantly, to thine own self be true. Okay, and then what we're going to do, we're going to try to stop, you know, stop sharing. I'm trying to, I apologize for cantering through that, but thank you for the questions. But I have allowed, we've got 5 minutes at the end. And as I say, we see this as part of an ongoing dialogue. Has anybody got any pressing questions that we haven't addressed so far? And feel free, your time to talk and mine to be quiet. Right, Chrissy's got her hands up.
Go ahead, Chrissy.
Hi, Claire. That was really good. Thank you. I think one of the things that's maybe running through the chat a little bit, but certainly stuff that I've experienced, is when you're trying to practice this compassionate leadership, taking time for yourself, taking time to talk to people, there's an insidious kind of run of criticism all the way through that about how can you have time to do that? I'm really busy. You're just standing around chatting. I haven't got time to come to my line management supervision session because I've got all these other things to do. And it's how, I suppose, how do we as individuals cope with that level of criticism whilst we still try to role model and practice this compassionate leadership? What advice have you got?
Again, all valid points and points that I hear all of the time. The first thing is, don't ever underestimate role modeling. Role modeling is something really, really important. If you're turning around saying, I haven't got time for you, then other people will go and say they haven't got time. So the first thing is, do continue to role model. And also, as I said, you know, just now, it doesn't need to take more time. I've had people that turn around and say, I used to start to do once a week that we'd go for a half-hour walk, get away, you know, if you've got a space, let's go for a walk, even if it's a 5-minute walk around the block. And people would say, I haven't got time for that. And what I would turn around and say is, when I go back to them, I say, but have you got any further with that thing you're working on the computer? Have you got any further with that monitoring that you've done? Or have you just spent the last 5 minutes just getting really, really angst about it? Whereas sometimes if you take that away and move, one of the greatest inventions is if people are able, from a physicality perspective, walking meetings, say, right, we've got to have this meeting, so let's walk and talk. Right, we've got to have this meeting, so let's take it somewhere else. If people haven't got the physicality to do that, let's take it out of the boardroom. Let's take it to another confidential spot, which might be a back room of a pub garden where you can go on a nice day and have a soda and lime and talk about something, changing the environment, just changing it up, that actually doesn't take any more time. And the good thing is that you will notice that people begin to surround themselves with more positivity rather than everybody coming in and moaning, going, well, there's no point doing that, that won't work, we haven't got time to do that, or this is just another thing we need to do. I had it yesterday when I was saying about the importance of supervisions, and people were saying, oh, it's just a tick box exercise, there's no point doing it. And I go, right, well, maybe we need to have a look. Why don't we turn them into a more compassionate conversation that actually people feel that they're valued? Because having a 5-minute compassionate conversation where I'm really getting to know people, John and I actually don't spend an awful lot of time together, but the time we do spend together, we find out about each other, we talk about each other. So I know that John surfs, I know that John sings. I mean, I haven't been a lifelong friend with John, but because, you know, we make time to listen and genuinely value each other. And the more you do that, people will find it's a nicer, and you flip that negativity. And actually, it's easier for people, because it's like the old thing that, you know, it takes more muscles to smile than it does, you know, to frown. I mean, and it's because you have got to put a bit of effort into it. But when you get the momentum going, it's worth it. It really, really is. You know, and one of the things, John, that we've spoken about before, it might be worth, if we can start exploring, maybe go towards, if people are open for it, some more longer sessions where we can really thrash out some of these and do some real live workshopping, so people can start to do some of this in practice away from the power hours. So we've got a couple of hours to really, if people are interested, really break this out and put some of these activities into practice. All right, Charlotte, so you've got your hand up.
Hi there. I'm bringing on my deputy to eventually succeed from me. What sort of key aspects would you say that that you should start with for in building the compassionate leadership?
Wonderful. Well, like I said, the first thing is that you'll be amazed how much, you know, your deputy will take on from you. So that's the first thing, is if they see you being compassionate, that's the best way. And the second thing is, say to them, it's that fact of actually, it's okay to take the time to be compassionate. If somebody, make eye contact with people, make an effort to talk to people. Little strategy. So if somebody say, look, everybody will want a slice of your time, you don't have to give your time immediately. And I'm conscious I've got 30 seconds left of my time. You don't have to make that time immediately, but you can turn around and say, look, I haven't got time to do that now, but let me know when you're available, and let's try and find some availability. Then I will give you my undivided attention. And just say those prompts. So without being all things, it's like an open door. People say, I have an open door policy. No, you don't, because you've got time, you've got to get on with your work. You don't want people coming in all of the time. What you do is say, I'm open to hearing you at an agreed time. So compassion, I would say the most important thing to say to begin with is, make that person feel valued and tell them to take the time. Do the exercise that I did. Find out 3 things that are interested and passionate about the team that she's going to be the deputy with. Find out about people, and she will see, or he will see, sorry, I don't know, they might see that is the most effective way forward. Give them a little task to say, right, what I want you to do on your first day, find out 3 things that our team are most interested in.
Yeah.
And then
we are out of time, Claire.
We are out of time. Please link in with me on LinkedIn if you want to, and I can carry on conversations. John is always open to us doing more and more and doing what you want. So if we want more of this for a longer period of time, because we now, I think this is going beyond the power hour to some real training sessions now, some real workshopping I'm hearing, John, which I'd be very happy to do. And I know you do some phenomenal stuff, and as the other colleagues at the Institute do. So we're always happy to build, aren't we, in response to people's need.
That's great. Thank you, Claire. And yes, you can expect to see more workshops, and as part of our high performance leadership activity in person around the country, you can expect to see compassionate leadership as a mainstay of that. Many of you have already been on various of our workshops. I hope you'll reflect that fact. We're mad keen on it because we know it works. All right, folks, that's it for today. Thanks to so many of you for coming on today. Thank you to Claire for all of her hard work in preparing for this, and no doubt we will see you all on the next one of these. Thank you very much indeed. Bye bye.
Thank you. Bye.
Thank you. Bye.
Thank you so much for your support, John.
That's all right. I think quite a lot of people wanted slides and so on. So we've got a copy of those slides.
We do. Yes, I always send those to Jay so she can send them literally straight after the meeting.
There we are. Okay, and
Yeah.
we've downloaded. So well done. That was grand.
Yeah.
Thank you very
No,
much.
it's great. And like I say, the only thing is now is that, and I've had this conversation with Jade before, that you can see the real want for it, and what you actually need is more time. I mean, but that's what we want. We want people to whet people's appetite, so we can say, right, let's do a session where we can actually bring your deputy along, and let's workshop some of these things so we can really thrash out all of those points.
Jolly good.
Which good. Thank you
All
so
right.
much, John.
Thanks a
Take
million.
care. Take care.
Well done, you. Thank you. Bye bye.
Go safely. See you.
Bye-bye.
Bye bye. Bye.